There's two ways to think of it. One is to think about some parents want every trigger pulled, every control controlled, in which case they want more. And some parents are very proactive about it, and they come in asking for multiple therapies at the same time. And those patients, we monitor them and we do multiple therapies at the same time. The second way to think of it is we introduce a second line of therapy if the first line of therapy is not controlling the growth or the progression as well as we would hope. I mentioned before, sometimes we would change therapy and change from one product to another product. If it's just moving a little bit, sometimes we add something else to it. So we've got a few patients that we're progressing even with MySight, and we've added in Atropine as well. I've had some other ones that we've had progressing even with Ortho-K, and we've added a little bit of Atropine in as well. So,
and how would you monitor whether your plan is working with the child? Like how do you actually tell if the strategies are being effective?
The two ways to tell is one is if their prescription is stable or progressing, is their vision getting worse, are their numbers changing? But the gold standard, as I mentioned before, is axial length measurement. So if we measure the axial length of children, it's that measurement which is a direct correlation to myopia risk and myopia progression. So how long the eye is from front to very back. And we've got a very high quality axial length measure as part of our Pentacam device, and we've got with our myopia control children, we just do an axial length measurement. We don't do a full workup on the Pentacam because the Pentacam can do lots of things, because that's how we monitor our orthopathology patients and start them on the process. That's how we fit specialty contact lenses, is by scanning the corneas with a detailed scan with the Pentacam as well. But no, the axial length measurement is a simple, very quick test that we do with that device. We've also got an axial length measurement on our OCT device, but we're finding the Pentacam is probably more accurate and more repeatable.